So let's talk about the crowding. The crowding is the lack of place. So is this bigger or is the jaw smaller? It's really what we need to discuss and what the diagnostic we need to do. On this case, there is no place for the incisor. So there is many ways to expand the arch, to expand the jaw, or to do an extraction. But it's like you park your car. If there is no place, you cannot park your car. So we need to find the way. If we look about the anatomy, the morphology, there is the tongue inside. So if you do extraction and you have a small upper arch, how you can manage the function and how you can have the good harmony. You look about this case, look about the maxilla. How you can put your tongue on the maxilla and how you can do your function without to adapt the function and not to have the good function for a good growth and for the stability of the treatment. Normally, the best way is to expand the jaw, then the tongue can go on the jaw and you can have the result. If you look about the edge, you need to open the suture, and if you need to open the suture, there need to be a way to do it. So you can change the jaw if it's for a young patient, and if you wait, it's only surgery. There is only two ways. We know that we can expand and you can move the jaw by blood and air who go inside the cellule, who can improve the growth. And then if you expand the jaw, you have the tongue who will take the place on the palate, and at the same time, the tongue can do this function. But because the way is to have the place for the teeth, in the same time you have the place for the teeth, you have the place for the tongue, you have the place for the brace, and at the end you have the place for the function. So if you want to change the function of the face, so the best way is to expand. So we use an appliance with the RCC3D, who is now designed by Biotech Dental, who really follow. And when you expand, you have the tongue who is going on the palate, so you can add the brace by the noise. So look about this case was published in the EGU in 2004. So because many people say yes, but you can wait to have all the teeth, you have no place. So because you cannot expand, you can do extraction. So it was a class 2 with crowding. There was no place for the canine, for the incisor. If you look about the profile, there is a lack of the chin. But because it's a class 2 with crowding, in this article they decide to do extraction of bicuspid. So it's really a way that use the orthodontists just around the world to have the good occlusion and to achieve really a good result about the alignment and the occlusion. You decide to do the extraction. So if you look about the case on the plaster model on the occlusion, it's really a nice case. And if you look about the smile, it's really a nice smile. And the patient is really happy about the treatment and the smile he just have after. But now, if you look about the smile in front of you, it's good. But now, if you want to take a look about what's happened on the function and what's happened about the profile of the patient, you think that you improved the growth, but you see that the upper lip is going forward, and you lose some part, of the red upper lip, So, and if you look about the nose, it's like you put all the teeth on the back. But if you put the teeth on the back because you've done the occlusion, you look about the X-ray and the simulation, you say, yes, we improved the growth of the mandibular. But the reality is not this one, because the reality we see on the profile, but the reality is really that you stop the growing of the maxilla, and at the end, on the profile, all the lip are on the back. But if the lip are on the back, you have the tongue who is on the back, you have the tongue who have not the place to do its function. So the more difficult is to be sure this treatment will be stable. Look about what's happening. If you look on the profile, you put the profile on the back, the lip on the back. so you have no place for the tongue. So this is another article of the EGO-DO about when we do extraction, what is the change of the palate. So you only take the dimension of the palate and you do a curve and look about the curve. For the case with non-extraction case, pre-treatment follow-up, it's like the same, because it's like an adult. And after pre-treatment and follow-up, there is a retraction of the maxilla. If you have a retraction of the maxilla, how you can do use function? So the best way is really to improve the growth of the jaw, but it could be only surgery or for young patients, because if you look about the suture, it's at the beginning. Look about this case, look about the teeth who are arriving. There is no place, so they go in front of the teeth. Because if when the teeth arrive, you need to have some place to be sure the teeth can go on the good way. So the only way on this case, when you have no place, is to expand the jaw. And only the upper jaw, because you see on the picture. But look about how we can expand. In this case, it's more than 6 to 7 millimeter. And if you look the result before and after, you have all the incisor, the lower incisor, not only the crossbite, And if you change the crossbite after you change the function, you have more place for the tongue, and you can correct the open bite, you can correct the deep bite, and you can really change the position of the teeth, the occlusion, and the function. Because now all need to work together. You cannot now only like when you are an orthodontist only to discuss about the occlusion. Occlusion is one of the functions, but all the people know that now you need to have the airway to breathe, and you need to have the place on your tongue to be sure you can do the good function, and not only the function of the face on the tongue, but really the function of all the patient, for his life. Look about this patient. For this case, there is no place. So you see, there is no place. It's why you need to do orthopedic pediatric treatment. You don't need to wait that the teeth arrive, because you see on this case there is no place for the teeth who will arrive, because there is no space between the teeth. So if you wait on this case, you know that at the end you will have a crowding. So when the teeth are aligned for children, at the end there is no place. So when the teeth are aligned, you need to expand, and you need to take the decision for an orthopedic treatment. Look about this case, a crowding for children. It's really crazy. So there is no place for the tongue. So the pediatric orthodontic treatment is really the future of the myofunctional orthodontic full treatment. So I think there is only one way, and if you look about all the face of the patient, you need to do an orthopedic pediatric treatment as soon as you see there is trouble.